will now proceed to our Q&A segment. So as usual, please scan to submit your questions. I do have a first question for our doctors here. So many people assume that lung cancer affects smokers, right? But that's not always the case. So how should someone who has never smoked in their entire life assess their risk?
You want to take it? I want to take it. Okay, I think so. As I said previously, in Singapore, most of our lung cancer cases occurs in non-smokers. Right, and although this, as Dr. Young showed the data, right, so far the screening guidelines has been in smokers, right, but in my I saw patients would come in to me and they says, my mother was diagnosed with lung cancer, and so should I go for a screen? I think there's some early data from Taiwan that's come out to show that in patients who have a family history, they should go for screening. This is not our current Singapore guidelines, but I think this is something that potentially you can look into if you have a family history of lung cancer. And anything else to add?
So sometimes the occupation also plays a part. So we have seen patients with high-risk industries. Typically, some of our patients worked in a volatile organic compound. They worked in a chemical factory. A lot of VOCs, as we call it, those benzene or smells of paint smells, those somehow also increases risk of cancers. And although their patient was young, non-smoker, we believe that environment may have contributed to that also. So the other one, of course, we talk about non-smokers, family history, but I think family history still is something that is we strongly advocate that if you do have a very strong family history, parents had cancers, or your brother with cancers, sometimes just to be on the safe side or to reassure yourself, sometimes the screening can be done.
Some questions in Slido, so perhaps doctors can pick the ones that they would like to address. We have about, I think, 5 minutes for questions.
Okay, I will address this question. Someone says, from your experience, what does the journey look like for lung cancer patients today compared to 10 to 15 years ago? I think the journey looks much brighter than it was 10 to 15 years ago. In the past, where before the advent of targeted therapy, before immunotherapy, whenever people had non-small cell lung cancers, we just had to treat them. Whenever we talk about stage 4 non-small cell lung cancer, we had to treat them in the same way. But now, with the advent of molecular profiling, personalised medicines, new systemic treatment therapy options, while we may not be able to cure metastatic lung cancer, patients are living much longer and with a much better quality of life. So I think this is that I'm very optimistic for the future for lung cancer.
Okay, yeah. How about the next question, which is
was lung cancer survival rates? Yes. So it's definitely has changed over the years because with a lot of treatment that my colleague has mentioned, that a lot of treatment options are now available, and it's a big market and there's a big area of research that new drugs are coming out, and therefore people can survive longer and not just survive, live well with on these treatments with lung cancers. So over the years, yes, treatment has improved survival, has improved quality of life for these patients. And over the years, and when you have longer survival, you actually are gainfully employed, your family is still with you, you actually have a good quality of life with stage 4 lung cancer. It is not impossible.
I think we have a lady in front who has a question.
Okay, myself is 63 now. I think about 2 or 3 years ago, through a normal medical report, a medical checkup, I was discovered scarring on my lungs. So I was sent to Tanujaa for check. So suspect of TB, but doctor deny. Okay, after test and after scope, TB is not in the reason, but the scar is still there until now. So is there any others medication or medical checkup should I follow?
So I understand that when you have a scarring on your x-ray, and a lot of people who have actually gone for health screening would show some abnormality in your x-rays, from nodules to scarring to atelectasis. And sometimes that can generate a lot of anxiety. But that's where the radiologist is looking at the a picture and giving his opinion. So the next step when you have scarring is sometimes we look at your previous x-rays. That's the simplest thing to do. We compare previous x-rays to your current x-rays, and some people are fastidious. They kept x-rays of 20 years ago. Every year they've got an x-ray and we can view and see whether things have changed over time. So one thing is if x-rays show the same issue over time, then we don't get so worried. But then again, you cannot assume scarring equals to no problem. There's some situations we call scar cancers. And typically people who have ongoing lung inflammation, they can cause scarring, but this scar can sometimes lead to cancers. So not assume as a scar is leave it alone, don't do it. You still have to go for checkup because it can lead to scar cancers, although rare. So to answer your question, comparing the previous x-rays, sometimes doing a scan can give you reassurance. But what happens is that once you've done a scan, you've done the x-ray, it doesn't stop there. You still need to continue to do regular follow-up to make sure that it doesn't change over time.
The medical checkup should I? Because at the moment, diagnostic hospitals are actually providing me like yearly X-ray.
Right.
Prior to this medical, I do not have scarring.
Right.
They have records. So with this medical
checkup, which I actually did for my vocational license, then it just happened that, oh, there's a scar.
Correct.
Okay, so over 2 years, I think doctors say that the scar did not diminish, but did not enlarge.
Yeah.
It is the same size or the same side, and scope has been done. And they tell me that they also did not know why or what causes that.
Right. So what causes
I guess she's asking for, is there another option that she can go for to confirm if that is truly a problem?
Well, if you do a
What's your advice?
scan, well, that's been mentioned. If you do a scan will give you more detail about what's happening in the in the area, gives you a bit more clearer picture. But a scan again will not guarantee that it may not mutate over time. So it's just a different form of imaging to give you a clearer detail and with higher percentage that it's a scar rather than something worrying. So regular follow-up, sometimes you want to do a scan at least one point of time, reassure yourself that it's purely scarring, then follow up over time. After that, also important. But if it's not changed in 2 years, good news. I think you continue to follow up. I think that's fine.
Okay, thank you. I think that's all the time we have for today, but not to worry. The questions that you have submitted, we will compile them and reach out to our doctors to help to address them at a later time. Thank you so much, doctors. Thank you.